Hello, Miss Ewing. How are you?
I'm just fine, Dr. Higgins. Feeling better than I felt about 6 weeks ago.
And you had your hip replaced 6 weeks ago, is that right?
That's yes. I had it. Today is Friday, and I had it done 6 weeks ago. This past Monday.
And how long were you in the hospital after surgery?
Let's see. I was out there. I went in on Monday. The surgery was about 1 or 1:30 on Monday, and then I went home the next day, about 4.
And when you started out after surgery, were you walking with a walker?
Yes, I had a walker. My husband had to take it up the stairs. I had to walk up, and I had no problem going up. I was hanging on with both hands to the railing, of course, but then I was walking upstairs, and then I went down, and he would take the walker down, and then I would get the walker. So I used the walker about 2 weeks.
And then were you using a cane after the walker?
Then I went into a cane, and I was practicing up in the bedroom, and I thought, I don't need this walker anymore. So I went down one day with the with the cane by myself, and went into the kitchen, and my husband was in there cleaning up, and I thought, hi, how are you? And he just about fell over. He went, what are you doing? I said, I'm with a cane. I feel better with a cane. And that was, I guess, about 2.5 weeks after the operation.
And how long did you use the cane?
I used a cane for about, probably about 10 days or something like that.
And now are you using anything? Or are you walking unassisted?
No, I'm not using a cane or anything.
Let me have you stand up. Let's see how you're walking now.
Okay. I hope I don't fall over. Okay.
Excellent. And what would you tell anyone who's thinking about surgery but thinks maybe they're not a good candidate or they might not be able to do it?
Well, I'm 85, and I would recommend it because it turned out that I didn't realize it, but my right hip was hurting from time to time for about 1.5 years or so, 2 years before this happened. And I just thought it was arthritis or something of that sort, and then a friend of mine sent me over here, and I saw you, and you went, no, it's not arthritis. You're going bone on bone. That's why it hurts. And I tell you, everybody at the hospital couldn't have been nicer. They all went out of their way to make me feel very comfortable. The anesthesiologist was delightful. We talked about marathons, and he had done 11 or 14, and I'd only done 1 marathon. And somewhere halfway through my marathon, I drifted off to Never Never Land. When I came back, I had a brand new hip, and I am so glad because I have no pain. It's just wonderful.
Well, that's terrific. Thank you very much.
You're more than welcome. Thank you.